Good morning, Miss Gracia. Today my group talk about teens pregnant. To continue, my friend Carlos Ceballos, he told about uh, after the pregnant.
Good morning, Ms. Racia. The teen pregnancy has been a concern among the women who begin their sexual life. In many cases, these women have no education or sexual orientation, which led them to be predisposed to pregnancy, which by their young age may not able to maintain, let alone to take life with a child on they know into studies and should truncate their life and career by the new regime that they as a burden, not a blessing and a normal marriage. Being under age their mother are considered as children and not have much legal authority over them, so that great responsibility falls on the grandparents. In many cases, the father is also a mother like no study job or complete studies. The best in this case is to prevent it by using con, con, anticonceptives. The best way to prevent pregnancy is to learn to say no. Before pregnancy, contraceptive methods. No, no contraceptive method is a 100% safe to latex condom, where women is the only contraceptive considered highly effective in reducing the risk of sexual transmitted disease, birth control pills, hormone implants, and the EUD, intrauterine T of, 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 of metal, do not protect against sexual transmitted disease. For women, oral contraceptives prevent pregnancy by the combination of hormones, estrogen, and progesterone, progestin. The hormones prevent ovulation. The pill must become every day as indicated in the prospectus and lose their effect in case of vomiting or diarrhea. Among the side effects that the pills are nausea, vomit, headache, breast pain, weight gain, irregular bleeding, and the and, and stressing. Copper TUD, a T-shaped sieve that is inserted into the uterus by a trained medical professional. The youth can remain in place for a period of seeing 5 10 years. This device is one of the methods with less failure rate as a contraceptive. Um, Female sterilization is done surgically. The fallopian tubes are blocked to prevent eggs being fertilized by sperm, thus preventing future pregnancy. It's a permanent birth control. Um, emergency contraception should be taken with 3 days after sexual intercourse without contraceptive protection to prevent unplanned pregnancy. The woman should take a pill Nolerbo and a second pill 12 and 24 hours later. The IUD for emergency contraception should be inserted waiting 5 days after unprotected sex. This device can remain in the body for a period of 5 to 10 years. For men, uh, now I talk about the conceptive method of men. Condom or latex, rubber, and can be used only once. Some contain spermicide to kill sperm. Function as machinal barrier, preventing sperm from contact with the vagina, preventing ejaculations from infected genitals, and avoiding genital lesions. Condoms are the most effective in reducing the risk of infection for viruses that cause AIDS and other sexually transmitted diseases. STDs method. It's a very important to put a condom properly before having sex. Male sterilization, also known as vasectomy, is a quick operation that is performed under local anesthesia. The post-surgical complications um, complications are not serious, for example, bleeding of infection. The ability of erection and ejaculation do not disappear. Sperm are a very small part, 1%. Sperm, and the man did not notice any difference in the ejaculation. The man's body will absorb the sperm. Thank you. Now, my partner Domenica talks about the intermediate pregnancy.
Okay. Young girls in the street, supermarket, hospital, and almost is any place with a big belly. In these days, is common to see those pregnant girls, to see those faces, girls who won't have normal teenage live just for not waiting to have sex. Not all of the cases are for that. There is different causes that explain with those girls to pregnant to those girls get pregnant. Teen pregnancy has different causes. One of these is the social pressures. When girls want to have sex because one of her friends do it just to not feel explode of the group. Another cause is that in the relationship, sometimes some boyfriends pursue their girlfriend to make love according to them to show that uh, he loves her. But these causes have a relation with the first I mentioned. Other is that some girls want to grow up fast, be adults, do things of adults, like have sex. None of them think in the consequence it brings having sex, and one of these, she could be pregnant. Being pregnant not only brings physical effects. It's bad because the girls stop going to school, stop her education. Those girls start thinking different, imagine themselves being mothers. Her minds have a mental stunted. They stop thinking in her teenager and start thinking about she's going to how she's going to uh, when they when her baby is gonna born. Their families don't look at them with the same eyes. In some families, those girls start being the shames of the family. In another, is more normal, and it happens more in these families that don't have much economic recourse and don't have too much education. My, my partner is going to continue.
Good morning, Miss Gracia. Today I will talk about the them pregnant. So the virus of baby will test different ways: hormonal, physical, emotional, psychological, and chemical level. And because of that, you may feel very tired, excited, frustrated, and worried. These mixtures of feelings can make you feel very stressed. You should try to be very clean. It's good for her to wash and to keep her genitals very clean. When bathing, do not sit in water until a week after birth. A woman who gave birth recently to eat more than usual. She can eat any food, including fish, meat, beans, grains, vegetables, and fruits. This food will help you recover and give energy to care for your baby. Rest, sleep as much and as often as you can, because the lack of sleep will make everything seem even more difficult. Also, eat nutritiously. Avoid junk food, which can cause rapid change in the level of blood sugar, increase your anxiety, and make you take a strong downturn after after you get over the first effect of satisfaction. Also avoid alcohol and make moderate exercise. Walk 20 and 30 minutes 2 or 3 days a week is ideal. You may also have challenge lengths and feet fields, constipate and have cramps. Even if you are not breastfeeding, you may milk out of her nipples and feel your breast hurt. They are sensitive or discomfort. Make sure the, the mother knows that breast milk is the best food for your baby. Let the baby with the mother so he can soothe and keep warm. Encourage the mother to keep the baby warm and clean to let it suckle as often as he wants. Often babies leave them a bit of yellow mucus from the eggs in the first weeks after birth. Flush eggs with breast milk or boiled and cooler water and and a clean cloth. You have you have to keep the pies of corn that feed the baby clean and dry. If possible, clean it with alcohol and clean cloth each time you change and appear during the first week. The big of bad legs and will fall. No need to cover in with anything unless there are flies or drugs. If so, you can cover with a clean piece of gauzes, a cloth, a cloth. Nothing at home you will need a safe place for the baby to sleep. And now this beard and adequate clothing and bedding to keep warm and protect. If you are feeding your baby formula, you also need a supply of formula. To continue, my my partner Domenica, he told the closing. Thank you.
Okay, I'm going to say the conclusions. How uh, we can to prevent or reduce the number of teenager pregnancies when when a girl can't uh, can can have the baby. The first things that we have to do is to teach the teens, talk then about those kind of themes. The first people that have to talk about this are the parents to bring them home education. Other is to put school programs because the teens spend the majority part of the time there. Programs to teach how to protect the case of doing because none of them think about the consequence that it brings if you do. Some things like that or solutions it shows the different kind of preventions method like use condom, take contraceptive pills to not get pregnant. Those are some of the solutions that we bring to the teens and their families to prevent teen pregnancy. And thank you.